Based on a recent survey, the biggest worry about retirement is not running out of money. Instead, people are most fearful of high medical expenses. Elaine Beadle from Beadle Financial joins us in studio today. Elaine, what's your reaction to this survey?
Well, I think it's kind of interesting. Bankrate.com did this survey and just released the results earlier this month. And they indicated that the #1 concern among Americans is actually the health care costs that they're going to have in retirement. And as you might expect, for those over 50, it was a higher percentage, and those under 50 where it was a lower percentage, because as you get older, you become more familiar with what the impact could be of medical costs. So that was #1. #2 was running out of money. #3 was not really being able to afford their lifestyle any longer. And #4 was being concerned with having too much debt.
So what should we expect to pay in terms of medical costs during retirement?
Well, that's another difficult question to answer, because it really depends on your personal situation. But the Benefits Consulting Group of Fidelity has done kind of an estimate from about 2002. Every year they say, here's how much you're going to need. So they take a 65-year-old couple retiring in 2014, and assuming that their lifespan would be 17 years for men, or about 82, and 20 years for women, or 85, what would the cost be? And they're coming up with $220,000 in today's dollars. But it's important to note that that does not include any kind of long-term care cost or nursing home cost.
So what is included in that $220,000?
Well, I think it's a reasonable number, because if you look at it, when you're retired and you go on to Medicare, you're typically going to pay for both Part B and Part D, the drug cost, and together that's about $3,500 a year for a couple. And then if you need to get a Medicare supplement plan, which you must have to help pay for your costs, that's going to be about $6,000 a year. And then if you just assume about $3,500 in out of pocket, that gets you to $13,000. If you just look at 17 years, that's at $220,000. So I think it's a very reasonable number. And then again, long-term care and those types of things aren't in there.
So it's understandable, I guess, that medical expenses would be the #1 retirement worry. So how do we plan for that?
Well, saving for retirement is so important, and you've got to include this factor in that number that you're saving for. So along with the travel you want to do and the cost of living that you're going to have, you've got to include medical care. And I continue to tell people, use those retirement plans provided by your employer or a self-employed plan or IRAs to help fund retirement, and again include this number. But also, if you're eligible during your working years to participate in a health savings account, which means you have a high deductible health plan, maximize your contributions there.